Okay, welcome everybody to the fifth virtual town hall that the Community Foundation is hosting to try and help our community learn more about what is happening with our citizens during COVID-19. So we've had some great webinars so far, and this one is going to be excellent as well. Just a few things before we get started. I wanted to just make sure that everybody understands that we are recording this session, and we will be posting the session to our website after the town hall is over. In addition, Shaw Cable has offered to rebroadcast all of our webinars on their community channel, so we will be doing that as well. It'll come out next week. And so please, if you could turn your camera and your microphone off during the webinar so that the recording is as clean as possible for our rebroadcast. And of course, there will be opportunities to ask questions at the end of the presentations. And if you could ask your questions at any time in the chat window, and then we will moderate those and pass them on to our speakers. So today's speakers are Kristi Yuris from Ending Violence Association of BC, Debbie Scarborough from the South Okanagan Women in Need Society, and Marieze Tarr from Desert Sun Counseling. So we are going to have Kristi Yuris speak first, and I'm going to now ask her to join the call. We'll just get started right away.
Great, thank you, Aaron. And thank you for the opportunity to be here. It's an honor to have this conversation. It's obviously a really important time, and we at EVA BC have been working really hard to try and respond to the needs of the anti-violence sector. I'm hoping I can just share my PowerPoint. I have a couple of slides that I'd like to share. Just give me a moment. Okay, so just to start, so there might be some folks who are in attendance today who aren't familiar with the work that we do at the Ending Violence Association of BC. So in essence, our mandate is to basically work to coordinate and support the work that folks are doing on the ground to provide services to victims and other anti-violence programs and initiatives in BC. So we currently support about 300 different victim-serving organizations and cross-sectoral coordination initiatives. We do this through the provision of issue-based consultation and analysis. We do a lot of resource development and training. We have a team that undertakes research and education projects, and we also support cross-sectoral coordination and collaboration. We provide day-to-day and ongoing support to community-based victim service programs, STV, Stopping the Violence counseling programs, STV outreach and multicultural programs, and coordination initiatives such as interagency case assessment teams, third-party reporting protocols, and coordination initiatives such as violence against women in relationships tables that work to identify and address systemic issues that are getting in the way of safety. I just wanted to draw people's attention to our website, which you can find at endingviolence.org. We have a number of resources and also COVID-19 specific information and links that are very helpful that folks may want to access. So just to draw your attention to that. Before I start talking more about the provincial response, I just wanted to take a moment to recognize, and I think this is something that we're all very much aware of and very cognizant of right now, that we know from research and anecdotal evidence that gender-based violence, including intimate partner violence, sexualized violence, and child abuse, does increase both during and after a disaster. And we're obviously very concerned at a provincial level about how those who are affected by violence are experiencing self-isolation and the reduction in in-person support services. We know that a lot of communities are experiencing increased reports, experiencing increased requests for services, and that many community-based programs are struggling to adjust to provide those services remotely. So we just want to first state to anyone who might be listening, whether you know somebody who's affected by violence or you're someone who's experiencing it themselves, that help is available. And I believe there are some local organizations that are probably going to be speaking to their particular services, but help is available during this time, either through local organizations or through Victim Link, which is a 24-hour service that's available in many languages. And these organizations can help with things like support, emotional support, safety planning, applying for emergency protection orders if you're experiencing violence. And also there's supports available for those who might be engaging in abuse, who may be using violence, either have been during their relationship or doing so now. So we definitely want to encourage those people to reach out and get supports as well. Those may be available through Victim Link. They may be available through local mental health services, or they may be available through, I know the BC Psychological Association is currently offering free counseling. So just want to reiterate that we know that there is going to be an increase in violence, but that there are many options available for support and services. Just to talk a little bit about what we're seeing in terms of the impacts in Canada and BC, we've been having a number of ongoing conference calls with our programs. We're doing conference calls bi-monthly with our CBVS and STV and outreach programs, as well as doing regular calls with ICATS and Bauer tables. And so trying to get a sense of what the needs of the sector are in terms of being able to respond effectively to the emergency needs that agencies and clients have. We're hearing a lot about the need for protective equipment, and this is going to be obviously something that's especially important as we're transitioning back into some degree of in-person service provision, with the government moving forward with slow introductions and changes in terms of policy. We're hearing a lot about the need for secure technology, cell phones, data minutes, laptops, issues around internet bandwidth and availability, especially in more rural and remote areas of the province. Other platforms to be able to provide counseling and support, whether those are through video conferencing, through teleconferencing, and obviously things like safe housing and transportation, financial supports, and a range of other issues. So we've been trying to work really hard, in particular with the provincial government, but also with the federal government, to try and address some of these concerns that have been identified. And some of the work that we've been doing at EVA, one of the things that I forgot to mention in this slide is we are currently in the process of, we were able to secure 7,000 masks, a number of thousands of gloves. We're working on securing shields and hand sanitizer, and those are going to be distributed to our anti-violence programs that we are working with. So hopefully that will provide, those are currently, I think they've been delivered to the Lower Mainland areas, and we're currently working on a strategy to get out that personal protective equipment to programs that are not based in the Lower Mainland. So hopefully that will provide the programs that we work with some basic equipment so that they can have that available for when they may be going into the office and or working in person with survivors. We've also been able and are very fortunate to have developed a partnership with TELUS, where we were able to distribute 200 free cell phones and 200 SIM cards for survivors who are at particular risk of high-risk domestic violence. So we worked with our interagency case assessment teams around the province to identify survivors that have needs for increased technological access. So those phones have been, we've done the call outs, we have, and we're currently in the process of getting those delivered. So those will be really helpful, especially for those survivors who otherwise don't have access to phones. And we're also working on a distribution plan for 400 free cell phones for anti-violence programs. So folks who are actually working in the sector. And these phones will be free for programs. And I believe that they're going to be free for a year. We've developed a number of one-page documents that are available on our website, and they deal with a number of different issues that are related to COVID specifically. So looking at trying to provide some plain language, but directed guidance to survivors who may be experiencing violence or maybe concerned about their increased risk during this time of isolation. We've also prepared one-pagers on working with women who have precarious immigration status, and also a one-pager that's directed towards those who may be using violence or abuse in their relationships and are really looking for some help and support. So all of those documents are available on our website again. And we, as I mentioned, we do have a specific link on our page that directs folks to resources that are related to COVID, both specifically for anti-violence programs, but also more general COVID information. We have a number of public service announcements that we've worked on with the BC Lions that address the question of how to be more than a bystander if you are, if you know someone who's experiencing violence and or are concerned about someone, or you witness something and you want some ideas of how to support and respond to that. We're also working on, and we know that a number of programs will be continuing to provide services remotely in some capacity or another. So we're just in the very last stages of developing some guidelines for our programs and initiatives that are directed towards maintaining confidentiality and appropriate records management practices while working remotely, and collecting and using personal information on behalf of clients during this time. Just a couple more things to reflect on the provincial level. As I mentioned, we are providing updates that anyone can access through our website. We've developed, one of the issues that we were really concerned about when this pandemic emerged was the potential for high risk cases or highest risk cases to possibly get lost, or for there to be snags at the local level, and there not to be an ability, because of service closures and because of courthouse closures and other effects on service provision. Our concern was that some highest risk cases might get missed, and that would be putting survivors and families and other people in jeopardy. So we've created this rapid response protocol, which has gone out to all of our member programs, that brings together senior level responders from police, the MCFD, community corrections, the BC Society of Transition Houses, as well as EVA BC. So if there is a case that's identified at the local level that hasn't been able to be resolved, and there are concerns about domestic violence in particular, but also sexual assault and child abuse not being able to be resolved, that can be brought forward, and that team of folks will work together to try and make sure that the necessary response and services are put into place. We're really hoping that and know that folks at the local level work really hard to collaborate and resolve problems as often as they can, but certainly having something available at a provincial level in the event that something goes wrong. We are really happy to have that in place, and really thankful for the partnerships that they have. We're working on continuing to advocate with both the provincial and the federal government for increased technological capacity for the anti-violence sector. One of the things that's been identified as a real barrier is just how in this sector, we really don't have a lot of money to devote towards things like laptops, in particular, and we're all working with a lot of old equipment. So We're still waiting to hear what's happening in terms of whether there's going to be any further investments in terms of tech capacity. We understand from the provincial government that this conversation is happening with the Ministry of Finance. So we're hoping to hear something soon about whether or not we are going to have an input of funding, which is very, very necessary. We also know that those programs that are funded through the Ministry of Public Safety and Solicitor General will have the ability to apply for additional funding for things like staff shortages, overtime, or any increased demand in services for COVID up to, they're saying at this point, up to May 31st. So if you are a program that is experiencing that need for additional funding, that's something to talk to your program manager about. In terms of what we're recommending, on a provincial level as well as on a federal level, our executive director, Tracy Porteous, has been in a number of conversations with WAGE at the federal level to talk about the needs of the sector as well as survivors. So really wanting to get across this message that, again, we know that there is going to be an increase in gender-based violence and that resources need to be put in place at every sector that's designated to respond, to be able to be prepared for that. And that there may be a lot of survivors right now who are reluctant to report or reluctant to come forward because of they may be afraid, they may be concerned that, this is not the right time to go to a hospital and get support, or they may not even know that services are available in the same way. So we definitely believe that that is going to shift. And I think we're hearing that from our programs, that there is an increase in reporting, and those resources need to be put in place to be able to respond to that. Deeming anti-violence services as an essential service, recognizing the impact of stress and vicarious trauma on anti-violence workers. Obviously, this is something that needs to be recognized ongoingly, but in particular when we're all dealing with self-isolation, we're all disconnected from our usual support networks and doing the best that we can to support each other via Zoom and teleconference, that we are going to need additional resources to reduce the impact of trauma and vicarious trauma on those folks who are on the front lines in particular. We're continuing to advocate for increased funding all the time and for increased support to the anti-violence sector, and including, and this is a particular passion of mine, and I know it's a passion for a number of people who work in this sector, to increase funding specifically for coordination work. So things like having core funding for interagency case assessment teams that respond to highest risk domestic violence. Most folks are doing that work off the side of their desks. They're doing a lot of coordination in their communities off the side of their desks. And so we're continuing to raise the need for these programs and initiatives to be funded so this work can be done adequately. We know that responding to gender-based violence requires the collaboration of all sectors. And so to have that work funded is really important. And we're also continuing to advocate for the flexibility that's going to be needed in terms of funding and reporting requirements, as those are going to be much more difficult to attend to during this time. And also ensuring that programs whose services may be affected by COVID, for example, if you're not able to do training, you're not able to do the normal service provision that you would do in quote unquote normal times, that doesn't have any effect on funding for organizations, that there's going to be no penalty or reduction in funding subsequently if folks are not able to do what they normally do. So we are going to continue to advocate and report back to our programs about what we're doing. So I really just want to quickly highlight Victim Link for people who might be on the call who are interested in, or wanting to know how to get in touch with Victim Link and what they do. And to encourage folks to reach out for support if they need to right now. And there's a lot of great folks who are there to support and provide that service. So thank you for the opportunity, and looking forward to any questions people might have.
That's great. Thank you very much, Kristi. Really, really excellent information. So I'd like to next invite Debbie Scarborough from Sowens to join us. Unmute yourself and turn your camera is already on. Excellent. Welcome, Debbie. Please tell us a little bit about yourself and your organization and how COVID is affecting the work that you do.
Well, thanks, Aaron. So I'm the executive director of Sowens, South Okanagan Women in Need Society. And of course, we provide services to the whole South Okanagan. And our services, and we're mandated to provide, I guess, programming and services to those impacted by intimate partner violence and sexual violence. So I love Kristi's overview of what the provisions are needed for the province and literally probably across the country. And what I'm probably going to talk about, or what I am going to talk about, is the frontline work. So what we're experiencing when the phone rings or when you're no longer able to get to the phone. So it's really impacted our ability to provide face-to-face services, as you can imagine with COVID-19. And if you imagine pre-COVID, Sowens was the face of anyone that had experienced intimate partner violence or sexual violence, in that we have a transition house or emergency shelter. We have a 24-hour crisis line. We have an administration where people can walk in off the street. We also have long-term housing, and we have second stage housing. And so we're still open, and we still provide all those services, albeit they're a little bit differently, or they are different. So we are no longer accepting walk-ins to our admin building. However, should someone not have a phone and be able to call in, then we do bring them in and set them up safely in a room that's already been set up for a phone, and they can talk to one of our counselors through there. We had to recreate how we do everything. So the first thing we did was create criteria, obviously, who can work remotely, who can still do their job effectively. And so our counselors, most of them are working remotely. But what that means, and Kristi alluded to it quite nicely, is do we have the right equipment? And what we found out is our server was really, really old. We had an IT audit done, and we kept crashing because now we have all this staff working from their remote locations from at home. So the server was crashing. So we quickly had to order a new server, which we still not received, new switches, new laptops, new cell phones. And that also meant providing cell phones to some of the women and youth that we were serving, making sure that they could still adequately access our services. So we had to do that from our administration building. We also had to change how we do service from the center, and we provide harm reduction and overdose prevention. So our mobile and that was a whole change. So that meant now, instead of 2 staff going out in our mobile outreach van providing services to those perhaps living in homelessness, living with addictions, and living with mental health concerns, we now had 2 vehicles traveling out, one driving in tandem with 1 worker in each. We have walkie-talkies when they get set up. We have cones set out. We have a megaphone, and we have a table. So we can ask what the client needs. We can get it, put it on the table, back away. We also created COVID kits. So there's hand sanitizer, there's soap, there's water, and there's towel, paper towel, that they can take care of some hygiene in their hands. And then when we talk about, I think what we're really interested in is the intimate partner violence response. And we know that this is really timely, actually, Aaron, because CBC is doing a series from coast to coast on intimate partner violence and how it's being further impacted by COVID-19. And so our transition house had to create also a new way of doing our business and providing services. So that meant that we had to ask questions when anyone called, and if they needed to self-isolate. It meant that we had to get rid of all the cloth furniture and go to wipables. It meant that we had to make sure staff had scrubs and shoes that stayed at work, and then the next staff that came on would wash them and put them back into the other staff's Rubbermaids. And it meant that we had to get additional staff, because when you think of each of us when we go shopping, all those everything has to be washed down and disinfected. And our cook just wasn't able to manage cooking for everyone, all our residents, all our women and children, as well as do all the cleaning of all the containers, all the fruit, all the vegetables, etc. So we've had to incur the costs of additional staffing. And then dishes. So how many people are going to handle them? So we had to go to all paper dishes, and we had to put them on a trolley. So they're in those to-go paper with the lids, 8x8 or whatever. Everyone gets served or plated, and they're taken on sterile trays on a trolley and deposited at each of the 19 bedrooms. And the door is knocked, and then the staff carries on. And so we made it a little bit fun, where the residents can then phone the staff and reserve a table. So be it in the dining room, keeping with social distancing, or out in the yard, which is privacy fenced, just to mix it up a little bit, because it can get a little bit monotonous in eating in your room. So we've had to change that out, and of course anyone coming and going. The other thing that really we've seen is that people obviously aren't able just to walk in our office or pick up the phone and talk, because now they're housed with their abuser. And so in the past, if we felt unsafe, we could either leave or we could pick up the phone when the abuser left. And now we're not able to. So we've had to adjust. So our crisis line, we've now enabled where people can, and it can text to our crisis line, and we can receive the text audio, and then we can reply on the computer. Are you safe? Do you need the RCMP, etc. We also found that some of the women and some of the youth were trying to email in between safety times when their abuser either wasn't there or when they were in the bathroom. Some have been in the closet trying to text for help or some counseling or some support. And so we've set up a live chat line, and it's staffed from 10 to 3. And you can just go on our website, sowens.com, and go to live chat. And then one of our counselors can engage, and we can talk to them. And then the minute that they exit, so if the abuser was to walk in the room, the minute they exit, there's no trace of that chat. So that's really important. The calls have definitely skyrocketed. And Kristi alluded to that as well. So during any crisis or disaster, the incidence of intimate partner violence and sexual violence escalates, and we know that statistically to be true. We already know that between 90 to 100 women and girls will be killed a year in this country and Canada, and about 100,000 women and girls will be abused in this country. So it's more than ever necessary for us to respond in all the different ways that we have to make sure that people understand we are still open. You can still come in. We're taking all the precautions. Everyone has their own bathroom, their own bedroom. And we put out a video that was launched in late April, saying you're not alone. And you may have seen it, Erin, but it was on the streets of Penticton, saying that we're still here for you. It's scary times. And so we are still open. If anyone is listening that does require our services, call our crisis line, text our crisis line, and we're still able to assist you. We also have 3 motels set up should you need to be self-isolating or quarantine, or the transition house where there's a number of women and children is not the best place, but you still need help and you need a safe place. So we're working with 3 local motels as well to provide those services.
That's great, Debbie. Thank you for that. I'm just curious, you talked about all the changes you've had to make in terms of the way you're delivering service in the transition houses, and as well as your technology upgrades. There's a lot of cost involved there. So I'm curious, how are you coping with that, and where's the funding coming from, and what's the long-term implication for your organization?
Yeah, well, that's a good question. I think there was some panic for sure when we when we did the IT audit and we realized that our server was old and was actually past its due date. And then, of course, you probably heard that Trudeau announced, first it was $50 million to go to the anti-violence sector, I believe, and then he upped it to $200 million because we realized, I think the government realized the impact of COVID-19 on intimate partner violence. So each transition house and shelter was able to apply and receive some funding. So that definitely helped. And that will pay for our server and some new laptops, new cell phones, etc. So that's definitely going to help. And there's some other assistance also with BC Housing because we actually had to, I didn't go into everything, but we had to change out our dining room tables and our cloth chairs. They were wood and we had to go to resin so we can easily disinfect and wash everything down. And again, that was a huge cost. So we are getting some assistance provincially, but as well nationally.
Great. That's good to hear. So my last question before I ask Marieze to join the call here is related to something Kristi mentioned about vicarious trauma for staff members. And obviously, I would assume that when you guys are able to work in the office together, you're able to monitor and support each other in a way that you can't do right now. So how is that affecting the way you interact with your staff? You have a lot of staff. Should maybe explain to everybody how many staff you have, and then how does that affect your ability to check in on people and make sure they're okay?
Yeah, well, that's an awesome question, actually. So we have 75 staff now. And so it's grown a lot in the past 5 years or 6 years that I've been here. And you're absolutely right. The visual, we take a lot of cues visually and even through our meeting every day, checking in on each other. So we still meet every morning at 9 o'clock virtually, of course, in our morning check-ins. So that continues. And, we all do talk about what will we incorporate, what will we continue in some of our practices after COVID is over. And I think that's one of them. When we think we always crowd in our boardroom every morning from all our programs would come in there and we could have 23 people. And I just don't think that's going to happen anymore. So one of it, we still check in. I think vicarious trauma, we still have access to our counselors, clinical supervision, etc. The one thing I will say, I don't think it's so much the vicarious trauma because we're all checking in actually more than ever. It's the isolation. So a lot of us come to work it's social as well. And so it's that piece. So many of us that are leading organizations are exhausted from that piece on checking in, how are you doing? Because I think that's where the struggle is actually working in our homes, especially if you live by yourself. There is no getting out, and virtual screens just don't cut it at the end of the day,
I think we found that it actually is more exhausting to be on Zoom calls than it is in person, right? And I have a theory on that. My theory is that we spend too much time virtually looking at our own self in the video, so we're monitoring the way we move and what we look like, which we don't do when we're in person. So I usually turn my camera off so I'm not drawn to look at how I'm sitting or something. Yeah, exactly. Trying to be on your best behavior all the time, right? And when you see yourself. Yeah. So, Debbie, thank you very much for your presentation. I'm sure there'll be some questions at the end, and I really appreciate you joining us today. So, thank you. I'd like to invite Marieze to now join the call, if you could, please.
Yes.
Hi, Marieze. Hi. Thank you for joining us.
No problem. So my name is Marieze and I am with Desert Sun Counseling and Resource Center. We serve the South Okanagan, OK Falls to Osoyoos. We also have a 24-hour crisis line. We have a safe home. Our safe home is not supervised, so we have 2 separate units. So we haven't quite had the challenges that Debbie was talking about. We just have to make sure that we clean our units really well in between different clients. We also have the contracts from the Ministry of Justice for the Stopping the Violence program, as well as the Peace program. And despite the 2 high-profile domestic violence cases that I'm sure most of you have seen on the local media, we have not seen a significant increase in the demand for our safe home. We also have not really seen, our crisis line seems to be a little bit more busier than normal, but not excessively so. We have had quite a few conversations with our victim services people as well as the RCMP. And what we are hearing from them, from most of them, is that a lot of people, although there is domestic violence, they are choosing not to access and not to leave their abusers at this time, and they are waiting. They're just not prepared to leave right now. Some for financial reasons, because they're not sure if in this climate they will be able to find a job afterwards. The interesting thing that we have heard from some of our clients who access our crisis line is that some of them say that their relationships have actually improved during the crisis. A lot of them find that the abusers have been laid off. So there's no excess funds to purchase drugs and alcohol. And so without the drugs and alcohol, they have found that the abuser actually became a better partner, a better father. So whether this will continue when they go back to work, you know, that is what we are not sure about. What else was the other thing I was going to talk a little bit about was what our STV counselors are hearing about from their clients. So our STV counselors and peace counselors, all of our counselors are also working remotely. They are doing telephonic consults, counseling. A lot of them were apprehensive at the beginning to start with this endeavor. One of our counselors did do a lot of telephonic consults before, so she was very comfortable with that. And actually all 3 of them have now found that there's definitely some positives to doing telephonic consults, and that a lot of clients are more on time, they're more committed to the consultations, and that there's less clients not turning up or coming in for their consults. What we are hearing from our STV counselors, that some of the women who are in abusive relationships are actually the levels of abuse have escalated, and that is also shown to us in the second case that was just in the paper last week, where a man in Oliver was arrested after a woman allegedly were abused, and then the RCMP found drugs and guns in the house. So there's, you know, they see escalation in the level of abuse. So a lot of interesting things, and it's so in our practice we sort of seeing things all over the map, And we have done our due diligence and checked in with the, various other agencies to see what they're seeing. And they kind of seeing the same thing. They, you know, they're not at this moment seeing a drastic increase in calls for domestic violence. But they are expecting, and we know that, that's all what the research shows us, is that there will be an increase in violence in the future as soon as this is over. And a lot of what we are expecting is that once this level of once we get to the next level and we are more free to move, we might see that increase in demand for our safe home and for our services. So yes, so that was what I was going to talk about. Thank you.
Thanks very much, Marieze. Just a quick question before we get to the Q&A. And if anyone else wants to add any questions to the chat window, please feel free to do so. We have a few minutes left on the call if you'd like to get your question in. But just one thing I wanted to clarify, Marieze, I think you said that you, with your existing clients, your workers actively check in with them to see how things are going.
Yes.
Is that correct? Yeah.
Yes.
Yeah. And so when that has been happening, it's been there hasn't been a particular increase in reporting of abuse. Is that my understanding?
So we, like I said, on our crisis line, on the one hand, we find that a lot of women that access our crisis line, you know, and was initially looking for and requesting services from our safe home, and wasn't too sure if they wanted to access the safe home right then. There were a few clients who actually said that the relationship between them and the abuser improved during lockdown, and that the abuser, because of less access to alcohol and drugs, were now a better partner and were less abusive, and also a better father. So that's one piece that we're seeing. And then yet we also, what we're hearing from our STV counselors is that a lot of there's an increase in the level of abuse happening. So the forms of abuse have increased. So there's threatening behaviors with guns and things like that wasn't there before lockdown. So
right.
Like for us, it's sort of a mixed bowl, and we're not, we know what research tells us is that, there is an increase in domestic violence during the lockdown. And so we are expecting, and in our conversations with the RCMP and victim services, we are thinking that once this is over, we are most probably going to see, an increased demand for services. Our referrals have stayed pretty constant through the whole lockdowns we started with COVID. So we haven't seen, initially we saw a slight increase and then it sort of leveled off, and it just sort of stayed stable at the same amount of clients accessing counseling or wanting to access counseling since before COVID. We also have an extra counselor at the moment on staff, so I think that also makes a difference. And that sort of has relieved the pressure right. of the other counselors. So.
That's great. Well, thank you very much, Marieze. We're going to take a few questions right now. Some of them have been answered through the chat, but I think it's a good idea if we answer them in the actual call. So if I could ask Sarah to join us now and just to moderate the questions that we've seen come in, that would be great. Are you here, Sarah? There we go.
I'm sorry. Hi, can everyone hear me?
Yes, we can.
I'll even turn on my video. That's great. Well, thank you so much. That was some really great information there. There was a couple of questions that came through just in regards to some of the services that Eva provides here provincially. So, Kristi, if you wouldn't mind just popping on and just reiterating what you mentioned there in the chat.
Sure. Yes, really good question, Keith. So our program, so EVA is a provincial organization. So we provide services to our member programs and coordination initiatives, regardless of where they're located across the province. So even though our main office is based in Vancouver, our services are province-wide. So anyone who's working within a member program, anyone who has questions about the work that EVA does, can definitely contact us. So we, I can tell you that we do a lot of, for example, we do a lot of training, and you know, over the last few years, I've been everywhere from Fort Nelson up near the Yukon border to Haida Gwaii, to Kelowna, to Vancouver. So certainly any program or initiative or anyone really who's curious and wants to know more about what we do can definitely get in touch with us. Yeah, because we are a province-wide organization.
That's great. Thanks so much. So I'm just going to circle back here. We had a comment here, and I'll actually address this to all three of the speakers. So can you comment on what to do when one is suspecting partner abuse in an elderly couple? So I'll start with you, Kristi.
Yeah, really, really good question. Thanks, Robin, for raising that. I did attach a link to, sorry, just going to start my video. I did attach a link within the chat. We did recently produce a one-page document that talks about what you can do if you're concerned about someone's safety during COVID, but it also is applicable if you have concerns about abuse that might be happening in a relationship anytime. I think, you know, and certainly I leave it to Marieze and Debbie to comment on this as well, but I think the most important thing that we can do in a circumstance like that is to offer unconditional support, to provide an ear to someone who may be experiencing violence and may not know what to do, may not know that it's something that they can talk about, it may not know that there's a place where they can access resources. We know that, you know, leaving abusive relationships is a very individualized, very complicated decision that survivors have to make. We know that many survivors will leave relationships multiple times, or may decide to stay in a relationship because of risk factors, because of love, because of family obligations. So knowing that there's somebody to listen and offer support and to allow that survivor to take steps that they need to take at their own pace is really important.
Great, thanks so much. So Debbie, do you want to go next and address that question?
Sure, thanks, Sarah. So I guess it would all depend if I was an individual that was visiting or knew this couple and I suspected, then I might, if I wasn't aware of the vocabulary or the resources, I might contact SOANS and ask what can I offer, what can I tell her? And let's say I had an opportunity or I provide transportation and I'm noticing bruises. It all depends on what signs that they suspect. Then I might actually have a moment with the victim and just say, you know, I'm noticing that there's some bruises. Are you okay? Do you know that there is a place that you can contact? So it depends on the relational piece with the people that she suspects, she or he. And then the other thing is there is an elderly abuse line and at the Interior Health Authority. But my first thing would be to contact SOANS, especially if this is someone that you have a relationship with, that you think you can broach and share what information is available. I was just saying earlier, the oldest client, the most mature client that we ever assisted was 86 when she realized that she could die at the hands of her abuser. And she had been with him for over 60 years. And she chose to leave with support. And it's been amazing, the transformation in her life.
Wow, thanks so much. Thanks for sharing. All right, Marieze, I'm going to ask you to answer that question as well too.
We actually have had quite a few elderly women access our services. Some referrals through Interior Health, some through social workers. And we have seen exactly the same thing. We have seen women leaving their partners after many, many years of being in an abusive relationship and coming out a lot stronger and a lot happier. People who were bent over, hardly ever had a smile on their face, you know, ended up being happy, social, well-connected people to their communities, so, and contributing members of their community. So I think that if you suspect abuse in an elderly couple, it really is important that you report it, or that you phone somebody, or that you seek help. You know, I don't think anyone deserves to live in a relationship or in a like that, and you know, it is not okay for anyone to be in that kind of relationship.
Great, thanks so much. So we had a question come in about whether or not there's support for women or families who have to leave their pets if they're in a bad situation. So maybe, Marieze, if you just want to continue on and quickly address this, I know.
So we lots of time women will actually not leave their abuser because of a pet, or you know, they don't want to leave the pets. So we actually, our safe home that we have now is pet friendly, and we allow pets. And if it's too big of a dog, or you know, if we don't think the dog is going to be a good fit for a safe home, we will organize care for the pet while the person is in the safe home, with the woman having free access to the pet while she's there, so that she's reassured that she doesn't have to choose between her pet or staying in that relationship. So we really try to accommodate, and we know that pets are a huge source of comfort for women, especially when they leave abusive relationships. So we try to nurture that relationship and help them continue with that relationship.
Great, thanks so much. And I'm going to pass that same question over to Debbie, and then I've got another question directly for you after.
Okay, I think, can you hear me? I'm not on mute, right? Okay, so yeah, we actually built kennels, Sarah, and so we as well know that women should not have to choose between their pets and safety. And so we have kennels for cats and dogs. And depending on how their size, etc., and whether they're good socially, and if they're a trauma dog, they can actually come right into the house, but not all dogs.
Great, thanks so much. And I know we're kind of short on time here, so there was a question directly for you, Debbie. So is someone providing the services that SOVAS used to provide? How does this fit with the services provided by the RCMP Victim Services Unit?
Great. Okay. So yes, we provide some services. So when SOVAS closed, then the contracts went out, requests for proposals went out, and we were successful in the community-based victim services piece. So we do provide services to those that are going to be going through court, and that's for any individual in relationship violence or intimate partner violence or sexual violence. When it comes to men being counseled or counseling services for men, that was taken over by the Access Center. Yeah.
Great, thanks so much. And just before we wrap it up here, Kristi, I'll just give you an opportunity to talk just with regards to that support for women and family to leave their pets. I know I didn't get a chance to ask you, so.
Yeah, thanks. One of the things that we've been doing at EVA, and in particular in the program that I manage, which is called Community Coordination for Women's Safety, and our program focuses on developing and fostering the coordinated response to gender-based violence. We've been working really closely with the Society the SPCA, the Society for the Prevention of Cruelty to Animals, to better integrate animal protection officers into the coordinated response and to help both folks who are working in animal abuse, but also folks who are working in the area of intimate partner violence to understand that those really important connections. We know, as both Debbie and Marieze said, pets are an incredibly important part of the family. They're often, you know, a source of comfort and solace. And they're also, when abuse is happening against an animal, it's often happening against children and other members of the family and vice versa. So I know that I just wanted to say that the SPCA is also offering a number of services, in particular in light of COVID. They are doing a number of things, including temporary fostering and boarding for survivors who are experiencing gender-based violence. So it would definitely be an option to get in touch with your local SPCA if you have one in your community. They can do some boarding. They're also working with folks who might need to be in quarantine or self-isolation, who've been exposed to COVID-19 and may need to access temporary care for their pets. They're also doing things like providing some emergency funding for if there are veterinary bills. They also have food banks for pets around the province. So in addition to the wonderful options that are available through the two organizations here, it is also possible to connect with the SPCA. And if that's one of the barriers that's identified to leaving, whether it's pets or farm animals, that is a resource that can be employed to assist and hopefully get rid of that barrier, because it's a really big one.
Great. Well, thank you so much. And I just wanted to say a big thank you to our speakers. You provided a lot of really great information today, and we appreciate you giving, you know, both a provincial and local perspective today. So thank you, Kristi and Debbie and Marieze. It doesn't look like there's any other questions, so it's 3 o'clock right on the dot. So thank you, everyone. I really appreciate it. Thank you to everyone who came on the Zoom call and listened. And, you know, I hope this is going to be enlightening or helping anyone out there. So thanks again.
Thank you very much.
Thanks. Bye.
Bye.